Welcome to CareTalk, America's home for incisive insights into healthcare, policy, and technology. And we have a particularly exciting guest today to talk about his healthcare journey, the journey of his company, and what he's doing to improve healthcare outcomes through technology and through engaging some of the most important caregivers and care practitioners, caring for some of the most vulnerable people in our healthcare system. Oron Afek, welcome to CareTalk.
John, thanks for having me. Very excited to be here.
So, Oron, maybe it would be helpful just for our audience to understand a little bit about your entrepreneur. Well, tell us a little bit about your company, but also maybe start with the entrepreneur. After that, talk to us a little bit about your entrepreneurial journey. Can you describe what your company does so that people can understand what the promise of technology in healthcare really means?
Yeah, sounds good. Vim is creating a marketplace, first of its kind marketplace for applications in healthcare. Simply put, think about the abundance of innovation Apple brought to the world with the App Store and how easy it is for us to download an app that does something that is single point and very focused and solve a problem for us. Healthcare is more complex than that, right? A lot of single point solutions have failed to scale, failed to get a critical mass, but also failed to be comprehensive enough. And so there's some sort of a bias in healthcare where, I've been seeing this for the last 11 years. Only certain companies are able to break through and get to meaningful scale. And we're trying to create a world where we allow innovation to accelerate and democratize innovation further, so it's easier for people to build companies at scale. So what Vim does, it's been 11 years in the making. We've been able to figure out a way to put a hook and to externalize and to abstract all the different constituents that make a difference in healthcare for app builders. So we have payer connectivity, very robust one. We are connected with all the...
I can try to, maybe you could describe how Vim is integrated into what doctors do every day.
Yeah. And as you said, that's maybe the most important piece. In order to influence healthcare decision, you have to be in workflow inside an EMR where providers are making decisions. They're seeing dozens of patients on a daily basis. That's where decisions are being made versus, let's say, patient-only kind of facing tools. So we had to figure out a way to meaningfully integrate into EMRs in a deep way that allows for bidirectional data exchange and application surfacing, and do this across all EMRs because the market is below Epic is pretty fragmented.
And just for folks to understand, electronic medical records are the essential workflow tool for doctors and nurses to actually manage initially really billing. I think financials are kind of what drove it initially, and then standardization from the federal government. And now it's an essential part of workflow, but it really wasn't originally designed to enhance what doctors and nurses and caregivers do in the clinical setting. It was really a billing and documentation tool. And I think what's exciting about what you're doing at Vim, what your ambitions are, is you want to take that up a different level and really not just improve the technology, but enhance that clinical experience. I mean, that's what I think about when I think about the promise of what Vim represents.
Definitely, John, and I'd like to double click on what you just said. They were designed as billing systems in a fee-for-service world. They were not been designed as a tool for value-based care, where there is interest in long-term patient health, in population health. They were not designed as AI platforms or AI operating systems. They were not designed as purpose platforms that can integrate with third-party solutions and to collaborate more broadly. And we bring all of that into those clinical workflows. So there is a way to accelerate innovation.
And how did you originally, what's the entrepreneurial journey that got you to founding and leading this company?
Yeah, back in the day, I was working on building a platform. My first professional experience was special forces back in the Israeli military, and then coming out of that, starting a company that's trying to build a way to allow developers to build once and deploy everywhere mobile apps. This is that predates iPhone, Android. There's a very fragmented environment of operating systems, Symbian, Java, and so on and so forth. You may remember that. So it was really tough to build an app across all those different devices. And we've been able to find a way to do it in a scalable fashion across many different devices. And I saw how our customers been using the platform. And I remember the other year being able to take 10 developers off the ground on the platform. A large mobile operator bought the company. And Steve Jobs announces the iPhone, and there are 10,000 developers kind of go off the ground in the first year. And you could see the power of, not having huge middlemen. In our case, it was large mobile operators, but having a direct connection between developers and consumers. And I think that was really powerful.
Just to draw the through line there, you were looking to create platforms to simplify and connect mobile devices. Mobile phones were getting more and more powerful. The promise of the Apple ecosystem, and honestly the Android ecosystem, is, well, we're gonna create a framework where then you can, almost to your point about a market of innovation that creates a clearer path that if you got it right, you then be able to scale it across those platforms. And I think that the other thing, insight, Oron, that I think is not everybody had, is that mobile was going to dominate. That it was not just a two-way walkie-talkie that you have a connected, a loosely digitally connected or analog connected device in the military. You'd actually have a computer in your hand, but also a sort of almost a connection factory. And I think that insight led you to kind of build what is hopefully working as a connection factory, one of the most complex ecosystems in the industry, which is healthcare. And I think that insight that mobile was the future, because I think at that time, a lot of healthcare technology vendors were still kind of focusing on PCs and enterprise, and you were very focused on mobile. What do you think drove that insight?
I think that similarly on the mobile side and what we're experiencing right now on the AI side, there's certain trends in the marketplace that just make you feel the world is about to change. And I think being where I'm at right now, not 20-year-old anymore, I feel like I'm starting to have this more pattern recognition of things are going to meaningfully change in a dramatic way, and the world's not going to be the same, and try to reimagine the world and how it's going to look like. But obviously, John, as you know better than me, healthcare has its own nuances. So, we couldn't just apply Apple in healthcare. We had to think about who are the real consumers, who makes the decisions of where the cost is going to be driven. Is it the patient or the physician? It's the physician. That was one thing. Who is paying for healthcare? Is this the patient or insurance companies? Okay, it's insurance companies. So you have to bring all of these into the same sandbox to play together. And to some extent, I think the 11-year in the making journey is all about trying to solve this chicken and egg and make sure everyone is playing in the same sandbox, so we can actually provide developers with good value. That was a big area of focus for us.
And so maybe to contextualize this, you've got this insight about mobile, you've got this insight about kind of distributed technology. You understand the silos, if you will, of information, and I'd say connectivity, but they're not, of the way clinical workflow happens, and frankly, interactions happen in healthcare. If you think about, again, stepping back, looking at it digitally, it doesn't really make sense. If you looked at conventional supply chains, or you looked at normal distributions or workflow in a lot of other workplaces, you'd have standard information, connected devices, wouldn't really matter whether they're cloud, on-prem, or mobile. Healthcare is much more fragmented. You've mentioned the different constituencies. Maybe give a couple of examples of, okay, you've established this view of a platform, you understand the complexity of the system, you want to be connected, you want to be relevant and high impact. what does Vim actually, how does Vim actually impact a doctor or a doctor's practice today, a patient and a patient's care journey today?
Yeah, definitely. So what we've done and what it allows us to do, and again, I don't think it solves the entire problem. I think either the government or local states will need to weigh in and solve another huge break, which I'm happy to talk about for just a second. But let's start with the technology. I think we've been able to integrate with all those different payers and other risk-bearing entities so we can get access to patient data, also HIEs and other elements that allows us to get patient data to the point of care. And then we also been able to normalize and understand different clinical workflows. And we put all of that into an SDK, a software layer that developers of all sorts, large and small companies, can build on top. And the promise is just like we did in mobile, was build once, deploy everywhere. So this is now in turn allowing developers to build applications that were, I would say, either impossible or really, really hard or expensive to build before. For example, surfacing open HEDIS gaps in care at the point of care, allowing provider to take action, closing the loop for reporting with the payer, allowing the provider to get paid, allowing the vendor to get paid, and really have a closed loop ecosystem without the vendor need to figure out a 10-year journey into contracting payers, providers, EMRs, and building something that, by the way,
I'd almost say it slightly differently. The power of just providing all of the information at the point of care is not a small thing. The average patient wouldn't realize that their doctors are constantly doing rework, except for the fact that they have to respond to the same questions every time they meet down the hall. And so that actually is a major gap that you are solving for. The SDK is the software development kit. What that means is by standardizing that platform and that access to information, you can actually create the opportunity for applications to be written and to solve basic problems like getting the documentation, automating that, getting paid. But also, as important for me, what's powerful is you've actually found a way to be part of what the workflow, what a doctor and a caregiver does every day. That's actually another big, to your point about the 11-year journey gap in the way most applications and application developers think about. They solve for the problem, but not how to actually engage with where the problem is sort of emerges. And so they're adding a connection problem or a more complexity to a doctor's workflow. And by helping a doctor, I think you're eventually helping patients. I just wanted to connect it. In fact, I would almost say you're almost solving for the closed looplets that are throughout the healthcare system. You're actually opening them up and connecting them. And that's a bigger problem for actually practitioners than probably most caregivers understand.
Yeah, I agreed. And I think this will not be complete until payment model is going to change and incentivize and pay physicians for taking action that is in line with what patient long-term interest is. And again, I think technology can only get us, to a certain extent, but, just using companies you've personally built in the past, you have to get to a state of risk. And, Vim is not a MSO or a risk-bearing entity, but, we want to see more risk-bearing entities leveraging the technology to truly align incentives between provider and long-term patient health. And do this not just for Medicare, do this for the entire commercial patients.
And by risk, what you're talking about is healthcare on a budget, whether it's by disease state or a transaction or a bundle. And so, so tell us a little bit about how's Vim doing right now? How have you done at scaling and connecting the dots for practitioners? One of the things that impressed me early on with your company is you saw the whole system. You weren't just creating an app for an individual diabetic or an orthopedic surgeon's practice, or how a health insurance company could bill and get documentation. You were actually looking at and connecting to all the different pieces. That was great. It's 11 years. How you doing?
Yeah, it's the last couple of years been very exciting for us. After a long and I would say kind of up and down type of journey, We are installed today with close to 50,000 medical practitioners at the point of care. We're seeing around 23 million patients in a given year, so 23 million unique patient encounters. And we have something to say for most of those encounters. So close to 150 million Americans are covered by the payers that we work with. So there's good chance we have something to say about a given patient, a given encounter. And we have close to 40 or so developers building on our platform right now. We only publicly published our SDK, our software developer kit, as you said, John, less than a year ago. So we are seeing some nice uplift and kind of developers coming in building. And we have all sorts of companies. It could be a 2-people person building an AI scribe company, or a larger team, or even one of the largest, Fortune 20 companies building applications to influence provider decision making.
So you're getting there on the platform piece. Let me go a slightly different direction on what do you think the advantages are of being an Israeli-American company? There's been this really emergence over the last decade of great entrepreneurs coming from Israel and attacking different aspects of the healthcare system. You're one of the leading ones of that. You were early on in this kind of productive diaspora or connected community between kind of Tel Aviv and Palo Alto. That I'm seeing more and more entrepreneurs who have similar backgrounds, but are part of this incredibly productive ecosystem in Israel around technology in general and healthcare technology in specific. What do you think the advantages are, and how would how do you think about that?
It's a really good question. I think there are a couple of advantages. The first advantage is the way Israelis understand healthcare is a very streamlined single payer system. So, I think you and I would agree that's what good looks like from a patient outcome and population health standpoint. It may not be the most absolute perfect thing for the economy
but from a technology perspective, it's one clean, connected system where everybody is using the same level of is complete information in the same format is remarkable. And it's one of the reasons why when Pfizer wanted to try out the mRNA vaccine,
there you go,
there's Israel as a partner, because they would have complete, transparent information in real time to make sure it was safe and effective. And people were wondering, like, why Israel when Pfizer's an international company? And it's because of the integrity and the and sort of the connectedness of the system in Israel.
And the long-term view of the patients, right? Because I've been with my HMO for 25 years now, so they know everything about me. I'm still keeping my HMO subscription in place. So that was the first reason, John. And the second thing that I think is kind of culturally very ingrained, healthcare is very complex, and sometimes overthinking and this could be expensive and long. So you need to bring different cultural, I would say, motivation. Israelis are very, I think, known and the quick and dirty. Let's get something done. Let's see what's happening, and kind of do before you think. They may not be as efficiently scaling companies. But the 0 to 1 is something I think we're doing pretty well culturally, given our slow tenure and being in a constant state of war. You need to act quickly and improvise and be resourceful. But a lot of the US-Israeli combination, which allow you to be both kind of good in the 0 to 1 and iterate quickly and fail quickly, but also benefit from the American kind of 1 to 2, and how do you now standardize and scale and build a large company, something Israelis at least originally were not really good at. So yeah.
And is it section 8400, 8200 that is the hard and soft technology part of the Israeli military? Maybe talk a little bit about how important that unit has been in terms of creating, again, another generation of health tech and tech entrepreneurs.
Yeah, I actually want to take this question and actually slightly. So 8200 is the very sexy, the very
Everybody apparently, when they're raising money,
popular.
says they're from 8200. Everybody.
Yeah, this is the largest unit in the Israeli military. It's intelligence forces. This is all the SIGINTs and HUMIT and COMETs, intelligence gathering of the Israeli military, and the entire security apparatus is based on this unit. They've been very successful and also been attracting amazing talent. And so a lot of the cybersecurity innovation, a lot of that hardware innovation is coming out of this unit. At the same time, I want to give a shout out to my co-founder, Asaf David, is in Tel Aviv right now. He came from the technology arm of the Israeli Air Force. And if you think about what Vim does, which is integrate with legacy software, which is EMRs, in a way that allows for modern day software architecture, that's what they've done in the Air Force. And that's the learnings we brought into healthcare. So think about a lot of the platform Israel been buying from the US over the years, buying, I mean, depends on you asking, F-15, F-16 to name a few. Those were created back in the 80s, but still they are modernly flying today and communicating with modern day software architecture like real-time drone assignment, target designation, all those kind of things. So the innovation for Vim specifically came from the Air Force, even though majority, as you said, of the innovation out of Israel is coming out of 8200.
Interesting. And maybe you could talk a little bit about, Oron, where you think the opportunities and the risks are in AI. There's as much intelligent information about the promise and the risks of AI as there is artificial and inaccurate information about AI. You're in the midst of this, as we all are in this. The waves hitting the beach, either in the right places or the wrong places, of applying computational intelligence at a different level. But maybe from your perspective, what do you see as the promise and the risk of AI right now?
Yeah, I'm going to paraphrase a dear friend and advisor, Vijay Patel. I think what we are seeing, and he said it like a year and a half ago, almost 2 years ago, what we're seeing, and that's where I think the opportunities are in the short term, a lot of quote unquote defense and offense, which is basically either making the provider to be more productive in the way they work. And it's not just ambient scribe, but even beyond that, like order automation, workflow automation, data standardization, summaries. I think, and at the same time, also preventing providers from doing mistakes, or at least highlighting potential issues when such are not being noticed. So that's kind of how I think defense and offense. And I think that's where the opportunity is. Risks are obviously moving to a more autonomous state where you can have a bunch of companies doing direct to consumer, and those, I think, LLMs that think in a more average state and may not have access to deep clinical data, they may end up determining average decisions that may end up risking patients that are in a state where they might need something more of an intervention, deeper intervention, and without a human eye looking at them with experience and pattern recognition. I think that could be pretty risky. So I think there's definitely more opportunities than risk. I think we need to have guardrails. We need to have the FDA thinking about it like they think about any other drug. I'm very excited about the future. I haven't been so excited before. Yeah,
I'm glad that you're as excited now as you were a few years ago, and you continue to build this great company. I think we'll wrap there on. Thank you so much for joining, and really appreciate it.
thank you.
That's it for another interesting discussion at CareTalk. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.